welcoming Susan Veleber.
Thanks, Matt. Good afternoon, everyone, and thanks for joining me. We're going to talk about acupuncture and the pain situation going on in the U.S. today and how they fit together. So we have our learning objectives, and we're going to talk about identifying, what do we know about the effectiveness and efficacy for acupuncture for different types of pain. And we're going to look at the safety and feasibility and some of the mechanisms of how acupuncture works for pain management specifically. And then we're going to talk about how adjunctive acupuncture treatment can reduce some of the opioid-like medications that have become a problem in the U.S. now. So we talk about the opioid epidemic and the opioid crisis, but really what we have is a pain crisis and a pain epidemic going on. A lot of Americans are in pain. If we look at the numbers, it's estimated that 25.3 million Americans suffer from chronic pain. And a lot more than that, 126 million American adults report some kind of pain in the past 3 months. I mean, if we look at the numbers of that, that's almost everyone in this room that has some kind of pain. We can all relate to pain and how we manage pain. But we're talking about severe pain too. I mean, not just your common pain. We come down to 14.4 million American adults experience the highest level of pain in category 4. So obviously we need to do something about that. The solution has mostly been opioids. If we look at the numbers over the past 2 decades, primarily in post-operative pain management, they rely incredibly on opioids. 80 to 94% of patients that have low-risk surgical procedures fill an opioid prescription within 7 days of their surgery. We look at the slide here and look at the huge rise just in the past 5 years of the amount of opioids, deaths in the U.S., and that has stemmed from all these prescriptions and the addictive quality of opioids. This is an interesting little slide of the U.S., and we can chisel out Ohio here, 28.5 deaths. That's million deaths in Ohio. And that's in 2016, there was 64,000 deaths in the U.S. related to opioid addiction. And when it comes down to also is opioids are really expensive. So when people become addicted to opioids and they're in pain, their productivity goes down. So this becomes an epidemic in the U.S. on multiple levels. We are not being productive and we're dying. So it is a national crisis. The President's Commission on Combating the Drug Addiction and the Opioid Crisis was initiated in 2017 and came out with their report on recommendations. So we start to look at acupuncture now, and this commission does include a recommendation for including behavioral programs, acupuncture, chiropractic, and other integrative and alternative means for dealing with pain and using non-opioid treatments, especially in post-surgical pain. And one of the main barriers that they discovered with this study was reimbursement. So prescriptions are covered by healthcare, and all of these other non-opioid treatments might not be. So part of this commission is looking at how to make these services more accessible to patients in need. Acupuncture has been recommended by over 870 institutions in their official clinical guidelines for 100 conditions in 30 countries for pain management. And specifically, the FDA, the National Academy of Science, Engineering, and Medicine, and the American College of Physicians have included acupuncture in their recommendations for guidelines of first-line therapy for pain management. The Joint Commission has mandated that hospitals provide non-pharmacological pain treatment modalities. So this is looking at the FDA. The FDA has had recommended that doctors learn more about acupuncture for pain management. That's learning about how acupuncture might work, what kind of pain it will be effective for, and how to recommend it to their patients. The National Academy of Science and Engineering Medicine has also supported non-drug approaches to pain management. And the Joint Commission is assessing hospitals on the availability and use of pharmacological and non-pharmacological therapies for pain management. So what the American College of Physicians guideline says, basically, is they were looking primarily at low back pain. And they used their grading system, and they made these recommendations for how to combat chronic low back pain. So these were the guidelines that they used, or the parameters they used for their search and in their research or analysis of studies. And their first recommendation for acute or subacute low back pain includes acupuncture, massage, spinal manipulation, with moderate quality evidence. So that's what they're recommending for their first line treatment for low back pain in the subacute or acute. For chronic low back pain, same thing. Initially select non-pharmacological treatments. Includes the same type of modalities: exercise, rehab, acupuncture, and mindful-based stress reduction all have moderate quality evidence. Then, in the final recommendation, when you haven't responded to those non-pharmacological treatments, then you can consider something in a medication. So the most recent guideline that has come down, it's the newest advisory from JCO. This was just a couple weeks ago, August 28th. They have recommended their options for pain, including physical interventions, acupuncture, massage, spinal manipulation. And they've also included some of these behavioral and cognitive treatments with meditation and muscle relaxation, music therapy, and topical products. So this is JCO's newest advisory, just hot off the presses. Also, that same week, the NIH's branch of integrative health, the NCCIH, appointed a new director, Dr. Langevin. She has done a lot of research on non-pharmacological treatments for pain. Specifically, she has done research since the mid-90s on acupuncture, the mechanisms of acupuncture. She's very interesting. She's a neuroendocrinologist, and she became interested in acupuncture because she had a lot of patients with pain, and she was giving them opioids and prescription medications, and they weren't really having any relief. So she actually went to acupuncture school and is a licensed acupuncturist, and she got very interested in how acupuncture was working, and we'll talk more about that later. The Attorney Generals of the U.S. got together and realized they were having a big problem in their states, and they put together some support for policy change for insurance to cover acupuncture and other non-opioid pain management options. So this is pretty big on the national front. We want to do something different than what we've been doing. And then here in Ohio, we are very fortunate. Our Ohio Medicaid has begun covering acupuncture for low back pain and migraines. It's chronic low back pain, just this year in 2018. But our employee health benefits here at the Cleveland Clinic have covered acupuncture for quite some time for chronic pain, headaches, migraines, and cancer-related pain. And we are all over our institution here. We have acupuncture locations in Lyndhurst, here at the main campus, Avon, Strongsville, Broadview Heights, Twinsburg, Lakewood, Amherst, and we also offer shared acupuncture appointments, which are in a group setting at Lyndhurst and Avon. Okay, so now we have all this talk about acupuncture, and it's being recommended for pain, but why? What is acupuncture? Acupuncture is a part of traditional Chinese medicine. Chinese medicine is a complete system of medicine, so it's a very different model of how we look at the person. Acupuncture is just one part of Chinese medicine, but it is the most popular here in the US. And in Chinese medicine, we use terms like meridians or acupuncture channels. We talk about an elusive thing called qi, which isn't probably actually that elusive, but here we think it is. It's not really measurable, so that becomes a challenge when we look at research. And we access those meridians through acupuncture points. You can see on the picture there, the red lines are the meridians, and where the black Chinese characters are, those are the acupuncture points. So we talk about qi flow, we talk about yin and yang, hot and cold. We look at the body as a microcosm of the universe. So things that we talk about out in the world, like damp and hot and cold, we see those imbalances within the body. And that's just a framework that the Chinese used when they developed the medicine, because that's what they knew. We talk about balancing the body, the whole person, the mind, body, and the spirit. So Chinese medicine also includes Tai Chi and Qigong and other things that are more related to the whole body than just acupuncture, that we can do treatments for ourselves. We treat on patterns of disharmony. So everyone has a diagnosis in Chinese medicine. We're not treating a headache. We're treating a person with, say, liver yang rising, and a manifestation of that is a headache. Then we choose specific acupuncture points to address that disharmony. And another thing that's different about acupuncture is that we are treating the root cause for each individual. Because although you're manifesting as a headache right now, down the road that could develop into other health problems. So we want to look at this whole picture and this whole person, and you could think of them as like a tree. And we treat the branch, that headache, we want that headache to get better, that branch to be healthy. But at the same time, we're also giving nutrients to the roots so that the whole tree is healthy, the whole system is flourishing and doesn't have other problems that come along the way. With acupuncture, we use filiform needles, acupuncture needles. They are solid. They don't have a hole through them as you would have for a blood draw or a vaccine of any kind. So they are very thin, fine needles. They're kind of like cat's whiskers. We also use cups, a tool called gua sha tool, moxibustion, and electroacupuncture. And we'll look at all these a little bit further. So here, a picture of our little acupuncture needles, if you haven't seen them before. They're a very fine gauge, anywhere between 28 and 40. And we put them into the acupuncture points. Each point prescription is written by the acupuncture practitioner. And as I said before, we're treating these patterns of disharmony. We put needles into acupuncture points, trigger points, motor points, or something we call Asher points, which are tender points. Then in addition to needles, we have a gua sha on the upper left, cupping in the middle on the top. That's the electroacupuncture, that clip on the needle. The moxibustion is an herb that we burn over the skin, and then a Chinese form of massage called Tui Na. So we have a lot of other physical medicine that we do along with the acupuncture treatment. Cupping is similar to massage, kind of the inverse. So it uses a vacuum seal instead of pressure to separate layers of the tissue, and it is not a needle technique. Gua sha is another non-needling technique. We use a tool and do instrument-assisted unidirectional press stroking. It's kind of like a gentle scraping on the skin, and it causes, you can see those red lines. Those are very severe, but for a view of the photo, I got a good one. That's called transient therapeutic petechiae, and there is an immune response that comes with that, and it also brings up debris, cellular debris that's trapped in the tissues to the surface where the body can process it out quicker. Moxibustion is an herb. It's a dried herb, artemisia or mugwort, and we don't burn that on the skin, but we might burn it over the skin an inch or so away, or put it on the needles, so it can involve needles or it cannot involve needles. Moxa is very warming, and it helps increase circulation as well. Electroacupuncture is something you're going to hear a lot about in the studies that we're going to talk about. It's very useful with a number of pain conditions, and it sends a small current of electricity through the needles into the tissue. We select specific frequencies for different kinds of treatments, and we can do continuous frequency or a mixed current, and then we set the intensity to the patient's tolerance. So electroacupuncture should not be painful, but you will feel stimulation that's different than just manual acupuncture. Okay, so that's from the Chinese medicine side. So how can we put this into our Western medicine minds, and what do we know about acupuncture and how it works now 5,000 years later after it's been put into practice? So we have done a lot of research on the mechanisms of acupuncture. Now, when we study the mechanisms of acupuncture, we aren't necessarily studying the effects of acupuncture or how effective acupuncture is. So when we do these studies, we look at all little bits and pieces, but we don't have one broad picture of a single mechanism of how acupuncture works. So we can explain a lot of things that are happening in the body, but we can't say directly one line of mechanism of how acupuncture is doing all these different kinds of pain relief. There's a lot more to learn, but we're going to look at what we know so far. So when we put a needle in a body, there is a mechanical action that happens. There's a physical action that happens right there. And in a broad view, we can say that mechanical action then causes a chain of other reactions. So biochemical reactions occur once that needle interacts with the body. There's some kind of sensory response that gets sensed through the nervous system, stimulates different aspects of the brain, and then a response is sent back out to the body through the way the body responds in biochemical processes. So it releases its own endogenous opioids, neurotransmitters, neurohormones. There's the gate control theory of pain. We know that substance P gets lower, we increase circulation, there's anti-inflammatory effects. But when we're talking about pain and acupuncture and pain, I want to look at one theory in particular, and that's acupuncture's effect on the connective tissue. So Dr. Langeman, who we met earlier, the new director of the NCCIH, her studies since the late 90s have looked at what happens when that acupuncture needle pierces the skin and first interacts. So she became interested in this because we as acupuncturists, when we put the needle into the skin, we don't just put it in. We put it in and we manipulate the needle. There are different techniques we use, a rotational force, we call lifting and thrusting, and we want to feel you, the patient, interact with that needle. And what it feels like to us, the best way of explaining it is like a fish biting on a hook. So if you've ever been fishing and you're sitting there doing nothing, that's us putting the needle in, and then all of a sudden there's tension on the needle. And we, as the acupuncturists, can manipulate that needle in different ways, in different directions, and to a different amount to cause more or less of a reaction around the needle. So what she's found is when that needle goes in, it's reacting with the fibroblasts. And so those fibroblasts are in the connective tissue, like fascia, which is all through the body. As we know, there's a whole scaffolding in the body of this connective tissue. It wraps around all of our muscles, all of our organs, our vessels, the lymphatic system. It's really everywhere. So this could possibly be how acupuncture, I can put a needle in your leg and it affects your shoulder through this connection of the fascia system and the nervous system. So as this connective tissue binds to the needle, it holds on for about 30 minutes. And when we do acupuncture, we advise leaving the needles in for about 30 minutes. And that's something that's been going on for thousands of years. And now in the past 20 years, we've found this response going on in the body. So these are some biopsies from some little rats who have helped us learn this. And you can see on the slide A, that's just when the needle goes in. There's really not much change in the tissue. There's maybe some cell proliferation, but on slide B, where the needle went in, you can see that the tissue has changed, and there are some whorls around where the needle is at the tip of the needle. So that's up on the top area. So now we're going to look at it again. These are ultrasound pictures. This is where the needle went in, and that connective tissue started to wrap around the needle. So this is a time sequence when the needle is being manipulated. Now they created all kinds of special robotics where they put the needle in and figure out how much force you could have on the needle and how many manipulations it took to get a certain amount of force. But this is a standard manipulation of an acupuncture needle. And you can see as we're manipulating that needle, the tissue winds around, kind of like spaghetti on a fork. So this photo down in the corner, that's the needle, and then nice yellow lines of spaghetti. Those are the collagen fibers, and the fibroblasts are embedded within that tissue there. The other thing that she's found with her studies is that the fibroblasts actually change. So the cell bodies of the fibroblasts, when they're having that stretch put on it, they become flat and larger. So they go from being small, dense structures to large, flat, pancake structures. And the area, now when they do these studies on a rat and they put a needle in, it goes around, the back, the front, the whole area becomes affected. On humans, we don't know yet exactly how large of an area it's having an effect on the connective tissue. But she's thinking now from what she's seen in her studies, several centimeters that needle has a response in an area about that big. So the other part is that acupuncture points that she's mapped, about 80% of the acupuncture points on the arm fall along these connective tissue planes or fascial planes. So they're areas where there's a really dense amount of connective tissue are where the acupuncture points lie. And we learn, when we learn how to find points, that acupuncture meridians are along grooves. So they're areas where we would think that there's a lot of connective tissue between a bone and a muscle, or along a plane between two muscles. So it's just enough, parallels of what we've studied and we learned thousands of years ago to what we're seeing now. It's a very good explanation of acupuncture, at least the initial of what's happening when that needle comes in. And this is specific for pain, because when we start to look at local needling for pain areas, that when those fibroblasts, when they have acute inflammation, that's a normal process. They do their thing, they heal the area, you get a cut, it makes a scab. They're all part of that process. But with chronic inflammation, we find that the fibroblasts start making more and more and more collagen. And that collagen becomes what we call fibrotic tissue. And it loses that ability to stretch. So if you think about, what pain feels like, especially in the beginning, it's like, you don't have as good a range of motion. There's pain as you move certain areas because you're not that nice, fluid, stretchy rubber band. And muscles and the fascia system, it's not just a unidirectional. They move together and they slide across each other in planes. And when they have fibrotic tissue, that slide mechanism they found doesn't have the same effect. So the muscle may move, but it's moving as a group instead of individually. So what acupuncture is doing, as we've learned from other mechanisms and studies, is decreasing inflammation. Chronic pain often stems from chronic inflammation and this fibrotic tissue. So if we know that we're decreasing inflammation and we're decreasing the amount of collagen laying down, this is a good explanation for how local acupuncture helps with pain. One of our more recent studies is on the fascia of the low back and how we never thought that fascia had sensory neurons in it. And so they're now finding that we do have sensory nerves in our fascia, and that people who have low back pain, that fascia is thicker, and that's that deposition of more collagen in the area. So because she has a training in Chinese medicine also, Dr. Langamine has some how Western terms and Chinese concepts could relate to each other. So she's proposing that acupuncture meridians are connective tissue planes, and acupuncture points are the convergent, where different connective tissue planes overlap or have a lot of activity. The qi is the sum of all body energetic phenomenon. So it's all of these things that we talk about. That is your qi. In Chinese medicine, we call that your life force. Another thing she's talking about particularly is the blockage of qi. We talk about qi stagnation is where there's pain. And that she's calling the blockage of qi is altered connective tissue matrix. This is what we were talking about with that collagen laying down in the fibrotic tissue. And then when that collagen gets thicker, the signal transduction comes down. All right. So basically what we know about acupuncture is it's working on the whole body in many different ways, in a neurological function, the endocrine and immunological systems, cardiovascular, the fascia, and electronic signaling. And the GI, this talk is mostly focusing on pain. So we're not going to talk about some of the other things that acupuncture does, but it is very good for digestive and GI complaints as well. So since we're talking about mechanism, and some of the studies we're going to look at will include a lot with electroacupuncture, we do know that different endorphins are released with different frequencies of electroacupuncture. And that's why I talked about how we choose specific frequencies for different kinds of pain and different locations of pain. Many studies are going to use sham as a control for against acupuncture. And sham acupuncture does have an effect. It is a physical intervention on the body. So then people started studying sham, and what does sham do, and how does sham work on the body? So sham can be acupuncture needle that doesn't penetrate the skin, or it could be a needle located, inserted in the skin, but not in an acupuncture point. So what they found is that, yes, sham does have an effect, but what it stimulates in the brain is going to have transient effects in pain. So when they do a study and they do a follow-up immediately after a treatment or within a certain time amount of treatment, sham is still going to have results. But when true acupuncture points are used, different parts of the brain, different opioid receptors they're more strengthened, and the effects are both short-term and long-term. Okay, so now let's look at some studies. I mean, why acupuncture? Why is it being useful for pain, and why is it being recommended so much? This is a systematic review from January. It found 122 conditions that acupuncture had been studied on. I pointed out in here as we talk about sham, and that placebo or sham acupuncture, it's not inert, so it's going to have some kind of an effect on the body. So this review showed strong evidence for 8 conditions. And then those are the 8 conditions that get studied a lot more, because we already have strong evidence for. Moderate evidence for 38, and then 71 with insufficient, and 5 with no evidence. It often found effectiveness and cost effectiveness for 10 conditions, and that it has been safe with very few adverse events when practiced by a trained practitioner. So here are our top 8. These have the most evidence for effectiveness with acupuncture. So allergic rhinitis, chemo-induced nausea and vomiting, and then we get into our pain. Chronic lower back pain, headache, knee arthritis, migraines, postoperative nausea and vomiting, and postoperative pain. Here's our next level, where we have moderate amount of evidence for. So Vickers and his crew, they did that first study in 2012, and it was they reran the numbers for 29 RCTs with a total of almost 18,000 patients. And these are the conditions that they found that acupuncture was effective and superior to sham. So back pain, neck pain, shoulder pain, chronic headache, and osteoarthritis. So you're starting to see how we've come to our guidelines, because these are the things that we're finding the most evidence for. Just this last year, 2018, they added 10 more trials into their studies, almost 21,000 patients from 39 trials, and they reran all those numbers from the original data again, and pretty much the same outcome. But they've expanded the kind of pain to any kind of musculoskeletal pain. It's not just our back pain, neck pain, shoulder pain, and keeping the knee osteoarthritis and the headaches. But the interesting part when they redid this study in 2018 and expanded is that they found the effects of acupuncture persist in time for a year. So after a course of acupuncture, people who had pain relief, those effects have lasted a year. Now I'm just going to throw this out there, this study on opioids. This was done also this year, 2018. This is the first study on the long-term effects of opioids, and it found that people, and this was compared opioids and other pharmacological, but non-opioids, and that people were in more pain. It does not support acupuncture, opioids for long-term pain relief. Okay, this is a huge study, because often with acupuncture studies, we don't have enough participants to really get strong evidence. This is a German study, 450,000 patients. And it was in chronic pain for about 3 years since diagnosis. 8.4 acupuncture sessions was the average number of treatments, and there were almost 9,000 people doing the acupuncture. Headache, low back pain, and or osteoarthritis, so they'd be coming from multiple conditions. 76% of the cases had marked or moderate effectiveness. There's a number of good studies on sciatic pain. So we're going to look at this one with 1,800 patients. Acupuncture was found to be superior to standard pharmacological care. So non-opioids, but just your standard care. Acupuncture in this study was second in global effect only to biological agents. So it beat out all opioids and non-opioid medication. Knee osteoarthritis, superior to sham, superior to physical therapy, Tai Chi, weight loss, and standard care and aerobic exercise. Plantar fasciitis this is another pain that hasn't come up before, but there's some good studies that have shown some good results and effectiveness for acupuncture with plantar fasciitis, and we do see this quite a bit in the clinic, so I included it because it's painful, and there's really not a lot else out there, and acupuncture was effective. In light of the recent US Open, I include the lateral elbow pain and superior or equal to conventional treatments, including injections and anti-inflammatories. So this is a little different kind of pain as well, but primary dysmenorrhea also over standard care. Fibromyalgia, this study and a number of studies have showed that electroacupuncture may be superior. And I include this because fibromyalgia, we don't always just treat the direct area of pain, and by doing the electroacupuncture, we're stimulating the brain in a different way that can affect the whole body, and especially with this stiffness associated, and we talked about earlier with the collagen fibers, this is a great study on fibromyalgia. And then what does the NIH say about acupuncture? They're going to go with the same areas we looked at before: low back pain, neck pain, osteo, knee arthritis and pain, headaches, and migraines. So it's been shown to reduce the frequency of tension headaches and then also be able to prevent migraine headaches. They recommend acupuncture as a reasonable option for people to consider with chronic pain. As I mentioned earlier, we have surgical pain as something that acupuncture is useful with, and that most people are prescribed opioids after surgery. So acupuncture does fit in nicely with stemming some of the problems with the opioid epidemic and post-surgical pain. And the first time that actually the U.S. became involved with acupuncture or knowing anything about it was in the 70s when James Reston, who was a press secretary, he was on the New York Times press, and he was in China with President Nixon and had an acute appendectomy, and acupuncture was used in his post-surgical pain management. So he came back and wrote an obituary for his appendix and discussed the use of acupuncture, and that is how acupuncture became known here in the U.S. So we have a lot of studies on acupuncture with post-operative pain and nausea, and so we're just going to have a list here. The main things that they are covering is post-operative pain, vomiting, nausea, recovery in general, reduced anesthesia, reduced analgesics, and less complications. So here we go with acupuncture and opioids. So this is a study that's going to talk about acupuncture compared with morphine. So this was in the emergency department, and they wanted to study acupuncture compared to morphine for acute pain, and there was moderate to severe pain. They found that there was a 50% or more reduction in pain, 92% in the acupuncture group versus 78% in the morphine group. The resolution time with acupuncture was 16 minutes, and it took 28 minutes with the morphine group. So acupuncture outperformed morphine as far as results there, marginally. But the key here also is the adverse events. There were 85 adverse events in the morphine group, and there were 4 in the acupuncture group. So acupuncture from this study was shown to be more effective, faster in pain relief, and better tolerated than morphine. It's probably cheaper too. Okay. So we're going to go back to our knee pain, and this study, we have already shown that acupuncture helps with knee pain, osteoarthritis of the knee. But this study showed that not only was pain reduced, but it reduced the use of opioids, the electroacupuncture, and delayed use of opioid. And this is after knee surgery. So this acupuncture was done the day of surgery. It was the first acupuncture. And I believe they had it every day while they were still in the hospital. And if you look at how much morphine the equivalents were given, it was over 48 hours. So delaying the use and when they needed more morphine. So studies are showing 60% decrease in using opioids after surgery. Here's another study. Both electroacupuncture and sham had reduced opioid-like medications, but the effects only lasted 8 weeks after their last acupuncture. So acupuncture is being used quite a bit in the military, and we can look at some of our acupuncture protocols that come from the military, but they are finding that acupuncture is dramatically decreasing the use of opioids and other pain medications among personnel. So the opioid prescriptions decreased by 45%, muscle relaxants by 34%, NSAIDs by 42%. So that's quite a bit of a reduction. And for the Army, they're looking at this in a lot of different ways, both for cost management and quality of life measures. Acupuncture can also help treat opioid dependency. So back in 1973, this was figured out sort of by mistake by Dr. Wen in Hong Kong, and he worked on a auricular protocol for opioid withdrawal signs and symptoms. And by 1985, a doctor in New York started the NADA, National Acupuncture Detoxification Association, for opioid withdrawal. And that program spans 40 countries. It has 25,000 providers at least that offer it, and more than 1,000 programs in the US and Canada offer acupuncture for addiction recovery. The NADA protocol that we talk about in the ear are 5 needles in the ear. We also include body points with that, with electroacupuncture. It talks a little bit about how they're working on the addictions. And there have been a lot of studies with acupuncture and addiction. And it's just part of the whole thing that we have to do to help people get off opioids, but acupuncture, not only with helping with the pain, does help with the withdrawals. So here's some of the proof of cost effectiveness of acupuncture. We're going back to that study that we looked at earlier with 122 different conditions. And this is where we've shown that there's cost effectiveness with utilizing acupuncture. Again, we're talking our same conditions: low back pain, neck pain, dysmenorrhea, migraine headache, and osteoarthritis. So this is a UK study. Kind of speeding up so we have some time here at the end. This is a study that was done in Massachusetts because they wanted to get acupuncture as mandated coverage for their insurance. And this is some of the savings that they calculated from other studies. They thought they would add between 38 and 76 cents per member's plan per month to include acupuncture. But the insurance companies would save $35,000 per patient per year with migraines. $9,000 for severe osteoarthritis. So some significant cost savings there. Study on migraines, that acupuncture is at least as effective as conventional drug preventative therapy for migraine, and is safe, long-lasting, and cost-effective. Talks a little more about how much money they're saving. Our same conditions, study after study. This big German study we talked about earlier, this is showing how many adverse events there were. The study had 450,000 patients. And minor adverse events were reported in 77.9% of the patients, and severe events were in 13 patients. That's 0.003%. So by minor adverse events, it could be pain where the needles were, could be bruising, hematoma, or bleeding at the needle site. Bleeding is usually very mild. But there are some serious adverse events that can happen with acupuncture. There can be, an organ puncture. There was some person had an asthma attack, and some people had or probably one person had a mood-related adverse event. So back to the NIH, there's very few complications with acupuncture that's been reported here in the U.S. especially. And the complications mostly have come from using non-sterile needles and improper delivery of treatment. But when delivered properly, it can cause, when not delivered properly, it can cause serious adverse events, which we talked about. The FDA regulates acupuncture needles. It regulates the safety of them, and it regulates who can use them, who can buy them. So standard, single-use, sterile, disposable needles. So acupuncture is effective, it's specific, and it's safe. It's one of the most effective non-pharmacological pain management options available, as we've seen from all these guidelines that have recommended it. And it's specific for opioid abuse and overuse. It can target those systems that opioids have sort of overrun and help with the pain as well as the addiction. And it's widely accepted as a general and safe procedure.